Good morning, everyone. Bon matin à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we'll be hearing remarks from Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, followed by Dr. Brent Mallockney, Deputy Medical Officer of Health, médecin adjoint en santé publique, and Dan Chénier, General Manager, Cultural and Facility Services, directeur général des loisirs, de la culture et des installations. Available for questions from the media following the statements, we also have disponible pour répondre aux questions des médias. Après les discours, nous accueillons aussi Anthony DiMonte, General Manager of Emergency and Protective Services, directeur général des services de protection et d'urgence. After we hear from panelists, we will take questions from the media. We will begin now with remarks by Councillor Keith Egli.
Thank you very much. Good morning, everyone. Bonjour, and thank you for joining us today. A year ago this July, COVID-19 vaccines were only a thought, and now, 1 year later in our city, we have achieved a remarkable milestone. As of this morning, 60% of all those aged 18 and above in the community have been vaccinated with not one, but 2 doses of COVID-19 vaccines.
Chair, you're just muted. After COVID-19 vaccines, you can proceed.
Okay, sorry about that. Over 80% of these 18 plus in Ottawa have received their first doses, which is also amazing news. If you're part of this group and currently have your second dose booked for the fall, OPH is encouraging you to visit our booking site to bump your appointment up to sooner so you can enjoy a 2-dose summer. If you're part of the roughly 20% in the community who is yet to be vaccinated, OPH would encourage you to drop in to any of our city-run clinics to receive your first dose at any time between 10 a.m. and 7 p.m. No appointment is necessary. For more information, you can visit www.ottawa.ca. The simple fact of the matter is that the more of us that are vaccinated, the safer our community will be. Every vaccination is like a brick in the wall against COVID. In other new and exciting news this week, OPH has updated our waitlist tool to reset weekly, making the user experience easier for those waiting to receive their first and/or second doses. The waitlist now lets users sign up for last-minute doses that are available at our community clinics. Members of the community can sign up for the waitlist visiting www.ottawapublichealth.ca/COVID-19 vaccine. We are also well on our way towards achieving community immunity, and we could not have done it without the support and participation from all of you. Please let us keep this effort going throughout the summer. With that, I'll pass it over to Dr. Brent Mallockney for his remarks and update, and thank you all for your time this morning. Merci, miigwech.
Thank you, Chair Egli, and hello, bonjour, quoi. This week, we reached another milestone in Ottawa, as Chair Egli said. 60% of people 18 and older have received 2 doses of the COVID-19 vaccine. This is encouraging news, Ottawa, and so let's keep up that momentum. There are plenty of appointments for second doses. If you haven't moved up your second dose, don't delay, and please do so today. Let's make this a 2-dose summer for as many Ottawans as possible. Si vous n'avez pas devancé votre deuxième dose, ne tardez pas, faites-le aujourd'hui. Faisons de cet été un été à 2 doses pour le plus grand nombre possible d'Ottaviens. I'm hearing that there are still questions about using mRNA vaccines interchangeably. That is receiving a different vaccine for your second dose than the one you received for your first dose. So for example, receiving Moderna as the second dose after a first dose of Pfizer, or vice versa. I want to reassure you, interchanging vaccines is safe and effective and is not a new practice. Similar vaccines from different manufacturers are used when vaccine supply or public health programs change. Je tiens à vous rassurer, la substitution de vaccins est sûre et efficace et n'est pas une pratique nouvelle. des vaccins similaires provenant de différents fabricants sont utilisés lorsque la disponibilité des vaccins ou les programmes de santé publique changent. For example, different vaccine products have been used to complete a vaccine series for influenza, hepatitis A, and others. Moderna and Pfizer remain interchangeable. For those aged 12 to 17, we solely give Pfizer for both doses. Receiving 2 doses of a COVID vaccine as quickly as possible is necessary to be fully protected against COVID. I also call upon parents, caregivers, youth, and young adults, spread the word, please, to youth, age 12 and older, and young adults. It's easier than ever for anyone in Ottawa to get their first dose if they haven't already. Anyone who still requires their first dose can walk in at an Ottawa vaccine clinic to get their shot, no appointment necessary. Toute personne qui a besoin de sa première dose peut se rendre dans une des cliniques de vaccination d'Ottawa pour se faire vacciner. Aucun rendez-vous n'est nécessaire. If you have questions about the vaccine, please visit Ottawa Public Health's website. There's a lot of great information there, or you can contact your healthcare provider or OPH to speak with a public health nurse by calling 613-580-6744. This Friday, Ottawa, along with the rest of Ontario, will move to Step 3 of the province's reopening plan. In Step 3, we'll see a further easing of restrictions. Larger gatherings will be permitted, and indoor dining and indoor fitness facilities will reopen their doors. Our community has worked hard to reach this next step, and I would like to extend my thanks to everyone who's rolled up their sleeve to get vaccinated. Your efforts are making a difference in our community. Ce vendredi, Ottawa et le reste de l'Ontario passeront à l'étape 3 du plan de réouverture de la province. À l'étape 3, nous verrons davantage d'assouplissement des restrictions. Je tiens à exprimer mes remerciements à tous ceux qui ont retroussé le manche pour se faire vacciner. Vos efforts font la différence dans votre communauté, dans notre communauté. While we are making significant progress, we need to stay ahead of the virus as we go into the fall. We continue to monitor the impact of each step we take, which might give COVID-19 more opportunity to spread. We know the Delta variant is more transmissible and is giving rise to resurgences in other countries despite high levels of immunization. Ottawa Public Health will keep an eye on hospitalizations as a key measure of whether the virus is reaching more vulnerable populations. Nous savons que le variant Delta est plus transmissible et que l'on voit une résurgence dans certains pays malgré des niveaux élevés d'immunisation. Santé publique Ottawa garderait un œil sur les hospitalisations comme mesure clé pour savoir si le virus atteint des populations plus vulnérables. The actions people continue to take, wearing masks indoors and in crowded places, practicing physical distancing, limiting close contacts, and getting 2 doses of COVID-19 vaccine are enabling us to keep COVID-19 levels at bay. Each day we are moving one step closer toward community immunity. Let's stay the course, Ottawa. Thank you.
Thank you very much, Dr. Malakny. We will now be hearing remarks from Dan Chenier.
Good morning, everyone. Bonjour à tous et à tous. Today, we're very excited that Step 3 of Provincial Reopening Plan expands recreation and cultural activities to indoor venues and competitive sports, both indoors and outdoors. It's been a long time, in fact, more than 3 months, that our residents have been able to access our recreation facilities or visit one of our galleries or museums. However, this reopening has a different feel around it based on the residents and staff inquiries over the last few weeks. There's certainly more excitement and optimism that we're back to stay, and we certainly hope so. The difference this time, of course, is that our community is moving towards our goal of immunity. Ce qui est différent cette fois-ci, c'est que notre communauté se dirige vers la cible de l'immunité collective. Residents and our staff alike are excited at the prospect of a sustained opening as we move forward. It's important to point out that we have designated hub centers to deliver our recreation and cultural facilities when we reopen this Friday. Some of the centers are not reopening right away as they will be serving as respite centers, testing facilities, and vaccination clinics for the next little while. However, the facilities we are reopening provide good geographical coverage across the entire city, and the reopening hub sites will be listed on ottawa.ca. We will announce when our other facilities open in the coming weeks and months. All of our sites and services will continue to follow all public health protocols and capacity limits set out by the province's most recent guidelines. Nos établissements et activités continueront d'être conformes aux mesures sanitaires et aux limites relatives aux capacités d'accueil établies par le gouvernement provincial. As a result, we'll continue to use our reservation system to book activity times. For those who love the pool, indoor public swimming and lane swims begin at selected pools this Friday. Reservations can be done online at ottawa.ca up to 2 days in advance, starting tonight at 6 p.m. Also starting Friday, we will resume drop-in activities by reservations at selected locations for things like cardio weight rooms, fitness classes, and older adult programs. Also, we still have openings in our summer Learn to Swim programs, open to all ages, which start the week of July the 26th. Schedule of fees have been adjusted for the restart of programs. Les horaires et les frais ont été modifiés dans le cadre de la reprise de ce programme. We are also starting to accept rental requests for arenas, arena slabs without ice, sports fields and ball diamond rentals, for play as early as July 16th. Contact our citywide facility allocations office for more information. Our galleries and cultural facilities will also gradually reopen over the next few weeks and into the fall. Nos galeries et installations culturelles rouvriront aussi progressivement au cours des prochaines semaines, et ce jusqu'à l'automne. Stay tuned as we continue to update residents on opening dates and the resumption of exhibits, activities, programs, and future performances at these facilities over the next few weeks and months. Our museums will start to offer indoor guided tours starting this Friday. You can book online at ottawa.ca for your visit. We will soon be announcing our fall recreation and cultural program in August. So get ready to explore our offerings and register for an activity that piques your interest, whether it's staying fit, exploring your creativity, or taking up a new hobby. The offerings will also include virtual sessions that were started during the pandemic, which are now a mainstay of our offering. Nous offrirons également des séances virtuelles. Le mode virtuel sera d'ailleurs pérennisé. They provide a convenient way for people to remain physically and mentally active in their home while accommodating busy schedules. Something important I wanted to highlight, as you know, many of our facilities and staff have actively contributed to the city's vaccination efforts and pandemic response. As we move into step 3, these facilities and staff will gradually return to their regular work to allow us to provide full complement of venues and programs. When you hear the vaccination stats and milestones, you understand the need and value for these contributions. C'est lorsque l'on voit les statistiques et les étapes franchies relatives à la vaccination que l'on comprend combien ces contributions étaient nécessaires et importantes. I want to personally thank all the recreation and cultural facility staff who have lent talent and expertise to the success of these community and pop-up clinics. Very proud of their efforts. In the end, these efforts will help us transition from focusing on restrictions and closures to bringing back fun and fitness and creativity back into our community. We are looking forward to welcoming everyone back to recreation and cultural facilities. Nous nous réjouissons de l'idée de vous revoir dans nos installations. Stay tuned to ottawa.ca recreation to see our offerings, schedules, and locations. Thank you. Merci beaucoup.
Merci beaucoup, Monsieur Chénier. I will now invite questions from each agency. I will be going in reverse order today. Nous allons aller au sens inverse aujourd'hui. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique à l'inverse. Vous pouvez poser une question et une question de suivi. Nous allons maintenant commencer avec Catherine Fortin à TVA Gatineau, Ottawa.
Oui, ma question, c'est concernant la phase 3. Pourquoi avoir décidé de la devancer plutôt que d'attendre que la situation soit encore plus stable du côté d'Ottawa?
Mr. Cheney, would you like to respond to that question? Est-ce que vous pouvez répondre? You're muted, Mr. Cheney.
Je ne suis pas certain que j'ai compris la question complètement, mais certainement, les règles provinciales nous permettent d'ouvrir le 16 juillet. Alors, de cette façon, on ne devance vraiment pas les règles provinciales. On s'enligne avec ce qui est permis au niveau provincial pour la réouverture des installations.
Parfait. Puis, pour ma question de suivi, je ne sais pas qui sera en mesure de répondre, mais c'est concernant les urgences. Au Québec, on a vu que ça débordait. Du côté de l'Ontario, est-ce qu'il y a une stabilisation? Est-ce qu'on constate que certains services peuvent reprendre? Est-ce qu'il y a encore des gros impacts? Parce qu'on sait qu'il y a de moins en moins de cas, de moins en moins de personnes hospitalisées. Donc, est-ce que ça semble redevenir plus ou moins normal?
Excuse-moi, Catherine, est-ce que tu peux un peu préciser c'est à qui tu aimerais poser ta question? Est-ce que c'est plutôt côté hospitalisation ou?
Je ne sais pas qui serait en mesure, mais ce serait au niveau des urgences, à savoir ce qu'il y en est de la situation. Est-ce qu'on est toujours débordé? Est-ce que ça se stabilise? Je ne sais pas qui serait
OK, alors côté santé et puis cas COVID, c'est ça?
Mm-hmm.
OK. Dr. Malakny, Catherine would like to know if the cases are stabilizing, how the hospitalizations are going, and the situation in Ottawa.
Okay, yeah, no, thank you for your question, and I'm going to need to answer it in English. So the situation here in Ottawa, the trend has been quite positive. Our number of cases, the positivity rate, which is the proportion of tests that are positive, hospitalizations, all of those have been trending downwards, and we're starting to see numbers of cases in a day being zero occasionally. The other thing, which is our early warning signal, which is the wastewater surveillance, which is very valuable to us as an early warning, is also staying low. And that's also available on a public website for everyone to be able to see. So all of those findings are quite positive in terms of their trends. The thing that we need to keep an eye on is, as I said in my opening remarks, any sign of a resurgence. This is something that we've seen in other countries, places like Israel, the UK, more recently the Netherlands, that as they pulled back from their restrictions, that they saw an increase in cases. And then with a bit of a delay, they've started to see increases in hospitalizations. So that's something that will always be front of mind for us. And we'll be keeping an eye on what happens going forward. And, if we start to see resurgences, we'll certainly be informing the public, but also decision makers as well.
Merci.
Merci beaucoup. Nous allons maintenant passer à Nafi Alibert à Radio-Canada.
Oui, bonjour. Ma question était sur l'avenir des centres de dépistage, en fait, puisqu'on a vu qu'à Ottawa, en moyenne, ils fonctionnent seulement à 10% de leur capacité maintenant. Donc, je voulais voir, qu'est-ce qu'on prévoit de faire avec les centres qui restent et surtout avec le personnel et donc les infrastructures.
Brent, do you want me to try to take that? It's about some of the things. Donc, au niveau des centres, on fait l'analyse actuellement, comme vous indiquez, au niveau du volume nécessaire. On veut continuer à garder certaines infrastructures en place et assurer qu'on a la capacité si jamais on voit qu'on a des cas qui commencent à augmenter. Pour santé publique, c'est important d'avoir cette capacité-là pour continuer à mesurer, mais c'est fort possible qu'on diminue le nombre total de centres de dépistage qu'on a actuellement. Et le personnel sera normalement réaffecté. La majorité du personnel dans ces centres-là viennent des établissements de santé, donc ils seront réaffectés des établissements de santé. Et comme la question tantôt du docteur Melantony, à la réponse du docteur Melantony, dans les hôpitaux, on commence à reprendre les activités normales, donc le personnel retournera là. Fait qu'on va continuer à faire l'analyse des besoins, mais on va sûrement garder quelques centres disponibles et on va être en mesure aussi, si nécessaire, de rouvrir encore d'autres centres si jamais la situation nécessite ce besoin.
Ben justement, là, il y a un peu une accalmie là, au niveau des dépistages, mais à quoi vous vous attendez si les cas reprennent à l'automne et je voulais vous entendre un peu sur quel rôle va jouer le dépistage comme preuve de je n'ai pas la maladie et ce qui pourrait être aussi une preuve vaccinale. J'ai 2 doses de vaccin, donc je n'ai pas besoin de me faire dépister. Je ne sais pas si vous comprenez.
Oui, je comprends votre question. Peut-être à ce moment-là, ce serait le docteur Melantony qui serait plus en mesure de répondre. I don't know if Kina, you could repeat it for Dr. Melantony.
Ou ce serait apprécié d'avoir une réponse en français, si possible.
Malheureusement, Nafi, M. Melantony peut pas toujours s'exprimer en anglais, en français, je veux dire. On peut toujours vous envoyer la réponse en français. Est-ce que vous voulez continuer avec votre question?
Oui, ou si quelqu'un pourrait reprendre après en français, éventuellement, ce qui est dit.
Okay, so Dr. Melantony, Nafi wants to know what role testing will be taking going forward. If testing will be required in some ways to prove that that COVID-19, that you're not positive of COVID-19, as well as the role of vaccinations. Nafi, est-ce que c'est ça?
Oui, c'est ça.
Okay, so let me take the last part of the question first. So the vaccinations will be really critical. So my earlier response where I was talking about needing to monitor for resurgences, the best way we can prevent a resurgence is to maximize our vaccine rates. And, you know, as Dr. Etches has said, we would like to get to 90% if possible, to be able to counteract the much higher transmissibility of the Delta variant. And we're on our way there, as we've reported today, in terms of the success we've had to date with vaccination. But we want to get the second doses in, everyone as quickly as possible, and then the individuals who haven't had their first dose yet, who are eligible, to make it as easy as possible for them to get vaccinated as well. Because in the long run, it's the vaccination rates that are going to be very important to keep resurgences away. In terms of testing, testing will continue to have an important role. What we saw last fall was that more people started to have symptoms as things opened up, and it's quite possible we are going to have that with us this fall. Especially as we spend more time indoors as the weather changes. And certainly the testing task force, which involves our healthcare and municipal partners, are planning for making sure that there continues to be testing through assessment centers. We're currently piloting take-home testing in day camps, and we'll be looking to be able to expand that to school settings in the fall. So I think testing will still play a very, very important role with respect to people who have symptoms. I think, even with vaccinations, people can still get infection. It typically is mild, but we'll still need screening as people come into workplaces or venues to ensure that people, if they have symptoms, they don't enter and that they get tested. So, some of the things that we've had in place up until this point will need to continue to be there as we want to prevent COVID from transmitting in our community.
Merci.
Thank you to both of you. Nafi, si vous aimeriez avoir ces remarques en français, je vous invite à contacter les relations médias de santé publique.
Je vous remercie.
We will now proceed with Taylor Blewett at Ottawa Citizen.
Thanks. My first question would be for Dr. Malakny. U Ottawa is mandating vaccination for students who want to live in residence. Is this a policy that OPH supports and would recommend other post-secondary institutions adopt?
So, I mean, the issue of mandatory vaccinations is really best addressed at the provincial level. I mean, we have lots of colleges and universities, not just in Ottawa, but across the province. So, in terms of having a policy for mandatory vaccination for this setting or any other setting, it's really the province that would be the lead here. But with that said, I mean, from OPH's perspective, we would certainly, strongly encourage people to be vaccinated. Coming into say a university setting, in a residence or other in classrooms, that's fit some of those C's that we worry about, right? And in terms of potential for crowding, potential for people to be in a confined space, the opportunity for prolonged close contact. And so in those sort of situations, would recommend, consideration of masking as well and distancing, but certainly would be recommending that as many people get vaccinated as possible.
Thanks. And just to follow up, I do believe that both Carleton and Algonquin, though, even on their websites where they talk about, they don't require this for students and residents at this time, but they do talk about, consulting with Ottawa Public Health. I think it's Algonquin that even says OPH doesn't recommend this for post-secondary institutions, mandatory vaccination. So is this something that if you're talking to these institutions about, or if they were to come to OPH and say, what do you think? What should we do? Like, what kind of information or guidance would you be providing them?
Yeah, no, I mean, I think that we, again, with respect to a policy for mandatory, ideally it'd be the provincial government which would make a decision in that regard. I mean, our job locally would be to provide advice to the university in terms of the range or package of interventions that they would need to be considering to try and reduce the risk of transmission as much as possible. Certainly, recommending high levels of vaccination. I mean, it's at the discretion of the particular institution whether they would have a policy. We can sort of outline some of the considerations for that, but also the other types of protective measures, in terms of screening for symptoms, and still the importance of masking and distancing and hand hygiene as well.
Thank you very much, Dr. Malakny. Thank you, Taylor. Nous allons maintenant passer à Julien Paquette à le droit.
Hi, I think this question would be for Dr. Malakny, and peut-être un peu aussi pour M. Chénier, mais we're announcing today some reopenings, and I guess my question is, how worried are we, or how probable is it at this point that we see the resurgence, as you mentioned before? Are we any worried about it, or we're pretty confident that we're reopening and we're not looking back?
Thank you, Julien. So, I mean, I think, as I said before, we need to be vigilant. I mean, the pandemic is not over. COVID is still around. COVID has shown itself over the last year and a half to take advantage of opportunities that we provide to it. We've made tremendous progress in terms of immunization coverage in the population, and we want to continue to improve that. We want people who are eligible for their second doses to get them and to come in as early as possible to do so. And we want the people who haven't gotten their first dose yet, who are eligible, to please come, because having the highest coverage rate of vaccine possible will be important to help protect us against resurgences. The whole idea of the provincial framework, as you know, here in Ontario, we're in step 2. We've been in that for a couple of weeks. We're going into step 3 on Friday. I think, considering where we are in terms of our our low case counts and our hospitalizations and the other measures that are all very, very favorable, that is, completely reasonable to be going to step 3. But, built into the framework is that minimum 3-week period to monitor if there's any sign of resurgence. We'll also need to be keeping an eye on in the fall, where we saw a pretty significant resurgence last year in terms of what occurs. And I think the experience that we've seen in other countries that have opened up and seen resurgences is cautionary for us. So it makes sense to do this in a phased approach and see what happens and monitor and then respond accordingly. But I mean, I think it would be important to emphasize that even though the case counts are low now and our vaccine rates are going up, there's still the possibility of a resurgence, and the pandemic's not over. And so we need to continue to increase vaccine rates, continue, in those closed, confined, prolonged contact with individuals, be looking at continuing masking and distancing in the meantime.
All right. And as a follow-up, just, you're mentioning the vaccination campaign that's going well. We've reached last week 50% of all adults getting their 2 doses. And you want to, Dr. Etches has mentioned, and you repeated today, that we want to reach at least 90% of people vaccinated. What's the expectation in terms of a plateau? Basically, what's the expectation for a ceiling in Ottawa for the proportion of people that get vaccinated?
I mean, really, the whole thing about COVID is it's been unprecedented, right? I mean, this has been, 18 months of this pandemic. I think it was Chair Eglai earlier who talked about, this time last year, a vaccine was a dream. And we now have vaccines. They came in just before the new year. We did long-term care and the most highly vulnerable populations first to protect them. And then it's, over the subsequent months, as more vaccines become available, as we've said, I mean, we've been able to get first doses in 80% of adults. And so I don't think we know what a ceiling. I mean, I think we just keep working and going and trying to increase access, provide people with the information that they need to make a decision, and continue to support and work with our partners to continuously increase the coverage rates, so that, frankly, we don't have those major resurgences that we're seeing in other countries. If I flip the vaccine numbers for a second here, so right now we've got over 80% of adults with first doses. If we look at a whole population, so all age groups, all people of our community, we're at about 70%. So that means there's since we're about 1 million people, that's 300,000 people who are not protected by vaccine. That currently is a lot of people that COVID can work with. So that's why we're, cautious in looking forward to monitor what happens as we reopen, because 300,000 people who haven't been vaccinated is a lot of people for COVID to work with. And that's why we want to have more vaccine coverage than we have now and keep pushing that up as high as we can. And we still need to have protective measures in place as we reopen to increase our chances of success and to monitor for those signs of resurgence and respond accordingly.
Thank you very much.
Merci beaucoup à vous deux. We will now proceed with Craig Lord at Global Ottawa.
Thanks very much. I just wanted to follow up on the questions Taylor was asking about university settings. Is there a downside, Dr. Malachny, to mask mandates, especially as you're talking about vaccine mandates, especially as you're talking about vaccine coverage being the most important thing for protection? What is the potential downside to making this a mandatory thing to be on campus in the fall?
So essentially, I mean, a place, whether it's say a university who has this kind of policy, I mean, they would need to have a conversation with their occupational health and safety people, with their labor relations and other legal support to think through the various scenarios that they may be faced with in terms of people providing proof of vaccination, what potential steps there might be if people refuse. Like, I mean, there are sort of devil in the details, as there are with any policy. And so an institution who is proceeding down this path needs to as I say, work with their internal resources and experts to think through the scenarios so that they have a robust policy. So what I'm trying to say is that is not just simple just to say we're going to have a policy. You have to think through how this is going to apply to people, both staff as well as students, and what happens if people, for example, do not want to provide personal health information, or what happens if a person does not wish to become immunized, and how will you deal with that? So it's a bit of work and for an organization, and they need to think through those scenarios.
Thank you. A quick follow-up to you then. What do you think is the argument? We have over 80% people have got at least a first dose. What do you think is the argument that will work for the holdouts there? Is it simply a matter of access, or is it something new that we need to try, like an incentive program or something like that? Like, what is the path forward to reach those holdouts at this point?
Yeah, I mean, I don't think there's going to be a one size fits all. I think that there'll be a variety of reasons why people have not been immunized. Some of it will be around access. And so bringing the vaccine to them, making it easy for people. So that's part of, for people wanting first doses, no longer needing to go through the appointment system. Just come to one of our clinics, we'll fit you in, and we'll get you immunized. We've had, a variety of strategies inside neighborhoods. And we continue to evolve that to improve uptake. We know it's going to take more effort. It always does for any sort of public health program when you have a remaining group to be able to reach them. I mean, just anecdotally, I can tell you, we've heard, for example, of parents who have small children and they have one or two jobs, and trying to shuffle all that and get vaccinated are challenging. So those are access issues, and by going to the people, that can help. There's also, in some cases, misinformation barriers, or just needing more information. And so we're working through community groups. We've done, webinars in a whole variety of languages. Often a trusted person from a language or cultural group is an important source of information. So we've been working with healthcare providers from different groups who are able then to speak, in their own language to communities. So there's not going to be one size fits all. There's going to be a whole range of strategies that we're already doing, but we'll continue to build on that to be able to bring vaccine to more people and gradually push up our coverage rates.
Thanks very much.
Thank you very much. We will now be going to Ted Raymond at CTV Ottawa.
Hi there. I guess I'll address this question to Mr. Chenier and Mr. Eglai as well, just in terms of the reopening of city facilities. We had Mayor Tory in Toronto talking about wanting vaccine passports or proof of vaccination to access services and things like that. What is the City of Ottawa's stance on requiring vaccination for accessing some of these new indoor facilities and city services and that sort of thing?
Thanks for the question, Ted. Right now, we are reopening on an appointment basis only. We are not requiring people to demonstrate that they have vaccines. The the return for most of our programs is under still very limited capacity, with essentially the predominant factor being maintaining distancing between people, the 2-meter distancing, both while they're participating in an event, but also change rooms and anywhere else in the buildings. So at this point, by appointment with limited numbers, but without a requirement. Of course, if, as Dr. Malakny suggested, should the province direct that proof of vaccine will be required, then we would implement that. But at this time, it's without proof of vaccine.
Chad, if I can just jump in, I think the approach that Dan has framed is a cautious one, but necessarily so. As we ease back into, what we'd like to call normal, we have to do it easily. We have to do it slowly. And I think Dr. Malakny spoke to this earlier and indicated that the passport issue is really a provincial issue. We're happy to work with the province on that, but that's really a provincial decision that would be made. And I don't know if Dr. Malakny wants to add any more to that.
Just to echo what you said, Chair Eglai, that the idea of a vaccine passport for domestic travel or access to venues is really a provincial lead. Just to add to that, a passport for international travel obviously would be the federal lead. And so for preventive measures, I mean, they're outlined in the regulations, and Dan has flagged those. The one I would add would be masking. Masking in locker rooms. Masking as you're walking between equipment, but with the exemption that if you're being vigorously active, that you don't have to wear a mask. Although from the public health side of things, we'd say that we would recommend you wear a mask even while you're exercising.
All right, thank you. I appreciate that. And as a follow-up, I guess Dr. Malakny and maybe Mr. Eglai can comment on this as well, just in terms of returning, talking about returning back to normal and returning city staff back to their usual jobs as testing and vaccination changes. Do you foresee in the near future a return to in-person city hall committee meetings, things of that nature, and what would be the requirements that you would think would be necessary for having councillors back in the council chambers and things of that nature?
I can start, and Chair Eglai, or Chair, do you want to start?
No, go ahead, Brent. That's fine.
I mean, I think that, the return of variety of city services, whether it's, more people back in the office, more, interactive kiosks type of thing, and at counter service, council service. I mean, those are all things that the city will need to view and look at preventive measures, and that's something that certainly we can support them. The thing I would say that the pandemic's not over. We're not out of this, and we would still be saying at this point to be cautious about a rapid return of people to indoor workplaces that are not essential to do that. And we're still at risk of that resurgence, as we've seen in other places in the upcoming weeks and months. So that's the caution, but certainly we will continue to support the city in making those kinds of decisions. Chair, did you want to add anything?
Yeah, just two quick things, Brent. I know the clerk's office is looking at this, figuring out how and when this might occur, and of course, any of those decisions would be informed by talking to public health. I guess the other interesting thing to note, though, is what we've seen during COVID and the use of Zoom and what have you for committee meetings. In some ways, we're getting far more community input with that process than when people would do it the more traditional ways and come down to a committee room or council chambers. So, I guess there are pros and cons as we look at it, but if you look at some of the numbers of delegations that have come out to Planning Committee, Police Services Board, even the health board, the numbers are up, the participation is there. So I think the clerk is trying to weigh all of those things in determining how we go forward.
Thank you very much.
Thank you, Ted. Thank you, Chair and Dr. Malachny. We will now be proceeding with Eric O'Brien at City News, Ottawa.
Good morning, everyone. My question is for Mr. DeMonte. One of my colleagues told me a story this morning. Her parent went to City Hall, apologies for that, went to City Hall to get their second dose. They said there was really no one there. So my question is the city having any issues with no-shows or any more issues with no-shows, or how do we explain this?
Yeah, no, thank you for the question. Actually, it's something that we're looking at as Dr. Malachny mentioned, when you look at the general population, there's about 300,000 people that are still outstanding, and then we're now up to 60% of those have got their second dose. So what we're actually observing is, and we knew this day would come, with all our sites opened up now, the volume of people versus our capacity, now we're kind of, the balance is now starting to shift. So we're actually looking, Eric, and this is normal, we thought of that, starting to close down, for lack of a better term, or start diminishing the number of sites that we have available. And in the next few weeks, we're doing that analysis. There are periods of times where the bookings, like an hour or two, are very slow, and then after that we're picked up. So we're trying to balance to not diminish capacity so people have easy access to the sites, but we are starting to see now some sites there's certain hours that are getting not as busy, and we have sites opened up. So we'll start probably going the opposite. We had 4, and then we went up to 11, and now we're going to start working our way back the other way. But we're going to do that very cautiously. And to be candid, I'd rather have a few days with a couple of sites have an hour here or there that aren't too busy, than close them down and then have, as Dr. Malachny was mentioning, areas where it creates another barrier for people to not get their vaccine. And the other thing, as was mentioned, we're now opening up to anybody who wants a first vaccine, just show up. So we're creating some capacity in the system as well for that, and we'll see how that goes. So this is a normal evolution of the operation, and we're starting to see it. So what the people that reported to you have observed is normal, and it's not just at City Hall. We've seen it at the Nepean Sportsplex as well, and the University of Ottawa. Those are the sites that we've observed the same type of situation.
Tony, I just wonder, it's Brent here, I'm wondering if you want to add around the number of people who have second doses booked, but in the future, and we want to move those into existing bookings.
Yeah, that's actually, thank you, Dr. Malachny. That's a great thing too. And maybe for everyone on the call, there's people that when they initially booked got automatically their second dose booked, and at the time was 4 months later on in September and October, and they're saying, okay, well, I'll go in September and October. We're actually encouraging them, and that's why, to your point as well, now that we're starting to see some capacity and we're opening up walk-ins, it would be tremendous if those people would rebook. We have capacity now while we have the 11 up and running, and there are appointments that are in September or October that they unbook those and book earlier. We have capacity in the system, and that'll allow us to keep the 11 in that big capacity. And more importantly, as Dr. Malachny's told us, we can have those numbers increase much more quickly, both in first and second doses, and get broader herd immunity or broader community immunity to ensure that we're protecting ourselves quicker. And school is coming, and that's an important factor for us. We want as many people immunized for that, so when we do return to normal school and people can get their kids back in school, that's done. And things are well on their way. So thanks for pointing that out, Brent. So if we could encourage people, please book an earlier appointment if you can.
Thanks, Dr. Malachny. That was actually my follow-up question too. So instead, I'll ask Mr. DeMonte this. Is it a cause for concern? You were saying like it was expected to happen, right? That the clinics were kind of going to slow down, but aren't we getting enough vaccines to completely fill up those clinics? Is it a cause for concern that the vaccines aren't getting into arms here?
No, it's not a cause for concern. It's a normal evolution of this operation. At the beginning, we had more capacity to do vaccines than we had vaccines. Then now we're having a significant amount of supply, and we are vaccinating a tremendous amount of our population. And that's just not pittering off, I think it's the wrong word, but things are slowing down, and it's a normal curve evolution. And what you've just described is just that we have overcapacity now. So what we're doing is looking at how we're going to titrate that overcapacity and start maybe going from 11 to maybe, instead 10, and then we're going to go to 9 sites and then go and work our way back down. But I don't think we'll completely close them. We want to leave until we get to where we need to get from a public health perspective, as high as possible, whatever that is. And so, no, Eric, on the contrary, this is just a normal evolution of this type of operation. We had to ramp up. Now we're fully ramped up. Now there's just not that as many people left to do. So 11 starts being, maybe that's over capacity, and we want to start titrating that and turning some of that down, because we're not going to have staff standing there in those operations and those costs if we don't have enough people to vaccinate. And we'll return those staff, which are often healthcare workers and the vast majority, and other city support workers, back to their core operations.
Thank you.
Thank you very much. We will now be going to Kimberly Molina at CBC Ottawa.
Good morning. My question is for Dr. Malakny. You talked about the 300,000 people unvaccinated across the city currently. What percentage of that number are children who are currently ineligible to be vaccinated? And are there concerns about the fall and the return to school if none of the vaccines are at that time approved for those under the age of 12?
Yeah, no, thanks, Kimberly. Yeah, no, you're quite right. The 300,000 number I gave an example of the number of people unimmunized includes younger children who are not yet eligible for immunization. The information at this point is best information is that immunizations for younger children will likely become available later in the fall, but there's a variety of steps that have to be gone through at the federal level before that gets confirmed. So I mean, for the upcoming school year, I mean, here are a few things. So first of all, the cases that we saw in schools last year, or the number of them, really reflected community transmission. So the more cases there were in the community, the more cases got imported into schools, because that's where most of the children who became infected, that's where they became infected, was in the community. So the more we have the community protected with high vaccine rates, as well as other preventive measures, the less community transmission we're going to have, and then the less opportunity for children to become infected in the community and to import the infections into schools. So that's the first point. The second point is that we really didn't see, with the layers of prevention that we had last year, much evidence of transmission within schools. As I said, most of the cases, most of the infections we saw in children, we thought came from having been infected in the community. We're certainly awaiting guidance from the provincial government in terms of the protective measures, those layers of protection that are going to be recommended for or required for schools. And so we're awaiting that, and that should be available, we understand, in the near future. And we'll work with our area school boards and support them to implement. The thing that we'll have compared to last year, though, is immunizations in the 12 to 17-year-olds. And it's been really, really tremendous to see the response of the people in Ottawa. We actually lead the province in the vaccine rates in that 12 to 17-year-old age group. And so that will be important, an important piece of the puzzle for this year. And then, once the vaccines are approved for younger children, to then make those available and encourage uptake of those. But in the meantime, we've got our series of protective measures, which were very effective last year in preventing widespread transmission in schools.
Sorry, just before I get to my second question, I missed if you mentioned this for the first part of my first question. Do you have a percentage or a number of how many of that 300,000 are the ones who are currently ineligible because of their age? I'm just trying to understand, like, is it 80% of that 300? Is it only 20%?
No, I mean, we can come back with and get that number to you afterwards. Okay. But it's a sizable chunk because the birth cohort's around 10,000. So, you know, it's probably about 100,000 or so are of younger children.
Okay, so about a third then of that 300,000.
OPH Media will get back to you after this
Okay.
to give you the precise number, so you have it right.
Sure, great. And then you spoke about the safety of mixing mRNA vaccines, but there are cases of people who did mix, and they're being treated as if they are unvaccinated when traveling to other countries. So I'm just wondering kind of what I know this is sort of outside of the local purview, but, you know, if there are local fears from people who want to go traveling and they're concerned that the country that they want to go to is not going to accept a mixing of vaccinations, what's your message to them?
So certainly the federal government is the lead for travel related policy, and one can anticipate the federal government working with their international colleagues to sort this situation out. And certainly Canada is by no means unique in using a mixed or interchanging schedule of vaccines. So one would think that this will get sorted out over time. But in terms of what we have in front of us here in Ottawa, so we're following the recommendations of the National Advisory Committee on Immunization. That's the expert national group that advises on vaccine policy. And their review of the existing scientific evidence and practice in other countries is saying it is completely safe and effective to be able to interchange the Moderna and Pfizer, which are essentially just different brands of the same type of vaccine. So from a science perspective and an evidence perspective, there really is not a concern with mixing or interchanging. And really, I mean, we have to be concerned about our situation on the ground here, where we're trying to prevent a resurgence. You know, pausing or delaying getting your second dose for perhaps some future travel concern, which may or may not end up existing, it needs to be weighed against you're vulnerable to the Delta variant. And the thing that's different with the Delta variant compared to the previous variants is the much less protective effect of one dose. It's only around 30-35% effective against the Delta variant. So if you delay and just stay with one dose of the mRNA vaccine, you are quite far away from the protective value you would have with two doses. And since we're trying to prevent transmission and resurgence here in Ottawa and Ontario, we are strongly recommending people get their second dose. And you know, the experience with other vaccines where we quite routinely have had changes in brands as part of the structure for numerous diseases. I think, and you know, I can't guarantee it, but one will think that the international travel restrictions and expectations will sort themselves out over time. But the real focus should be on how to get protected from COVID right now. And that's getting your second dose as quickly as possible.
Thank you very much. Thank you everyone for your time today. This concludes our media avail. Ceci conclut notre point de presse pour aujourd'hui. Have a great day. Bonne journée.